Hi, this is Kim Reger from National American University, and I'm here today to talk to you about one of the most valuable resources an emergency department nurse can have, and that is the resource of time. Time is something that's not tangible, but it's certainly important to how we can care for our patients. Time is one of those things that we need to eliminate as a wasted resource within healthcare. And one of the reasons why it becomes even more and more important right now is that we have to publicly report our turnaround times, not only for length of stay overall, but we also have to report it specifically for departed decision, the decision to admit, to the actual departure time. Now that is a very short window normally, but sometimes it can be very long. And one of the steps within that process is the creation of a tool that we use to hand off our care to the next patient. There have to be safety systems in place no matter what we do, whatever system we employ, because we have to make sure that that handoff is safe for the patient as they move through the hospital setting. Our current handoff process, we do a handwritten SBAR tool, that's Situation Background Assessment and Recommendation. That document is filled out by the ER nurse who's going through the electronic health record ER summary and then copying down bits and pieces of that information to put onto this other paper tool. Reports then called to the floor using that same piece of paper, and then the patient is taken to the floor to that assigned room. And if there's any changes that happen between the time they had that conversation over the telephone to the time that they're actually departing the patient in the room, that conversation's had at the bedside with the nurse and as well as with the patient being involved. My suggested time-saving process would be that the ERRN completes all the documentation within the computerized documentation system while we're waiting for that bed to be assigned. We have a few minutes when we know that we're going to be admitting to the time that we actually get the bed called to us by the health supervisor. Once that bed's assigned, then we start the time clock and we give the floor 15 minutes to have their nurse that's going to accept that patient review the electronic ER summary, which is the same document that we were looking at. And then if they have questions or if they want to jot down their own notes, then they can document whatever they feel is important to go over once we get actually at the bedside with them. Once we arrive in the patient's room, the nurse would meet us and we would go over, again, any questions that that person had, as well as any updates we had on our end from the ER. And then the patient is also hearing that same information, which is very important that they're involved in our handoff process. Why is this a good idea? Well, Lee et al. Found that the use of computerized document handoff tools, called CHTs, could reduce adverse events, improve overall quality of handoff, and potentially enhance the work efficiency and continuity of care during the handoff. Also, very important, the Institute of Medicine has recommended that hospitals adopt robust information systems to improve the safety and quality of emergency care, enhance hospital efficiencies. An additional reason, there is a no-delay nurse reports have found to reduce time from admit orders to arrival on the inpatient unit. It decreases the potential for handoff errors because it ensures that both the ED and the inpatient nurse have the same information in front of them. It also increases the patient's perception of care due to timely transfer of care. And the authors of this research article went on to say that the best way to hand off this patient information is through the use of the EHR. This article was written by Baker and Espenshade in 2015, and I had the fortunate experience of being able to work directly with Ms. Espenshade when she came to visit our hospital a couple weeks ago to look at our patient flow process. And we have a very good flow process, and we're well below the national standard as far as our times. But the one thing she pointed out to me as a way to improve the situation, not necessarily going to be well liked by the floor initially, but something that would improve the ER efficiency, was going to be to go to this electronic EHR summary that the floor would have to read and then ask questions versus us trying to transcribe it. Anytime you start writing down information, you take the chance that you're going to do something wrong and move the decimal point or eliminate something that you thought you had written that was very important to the care of that patient. How is this reduced waste of time resources? Well, as I was saying, what one nurse views as being very important or valuable information may not be the valuable information that they also have or have value placed on it. The ER nurse values certain things and the inpatient nurses value things. I can tell you an ER nurse really does not care the last time somebody went potty. They want to know, when did they last have their pain medicines, what are their vital signs, what interventions and care did we do for them. We're not looking at the whole long-term picture, whereas the inpatient nurse, that is part of their focus. And once all the inpatient nurses are comfortable with the use of the EHR that the ED is able to provide within the computerized system, there will be no need for them to actually even take any notes in the future either. In the ED setting, as I said, time is a very limited resource, and when rushing, it's easy to make those mistakes, which are transcription errors, and that leads to safety issues, which none of us want, and correcting those safety issues also requires additional time constraints as well. So in conclusion, the electronic health record has been designed to have patient information available across the entire healthcare spectrum. It's extremely important for continuity of care and eliminates variance in what information is seen by individuals. And time spent picking and choosing what you write down for the next person to see is wasted time. And time is a resource the ED nurse cannot afford to waste. My references, Baker and Espenshade, as I said, partnering effectively with inpatient leaders for improved emergency department throughput in the Advanced Emergency Nursing Journal. And then Lee et al. Review of computerized physician handoff tools for improving the quality of patient care, Journal of Hospital Medicine. And then Bartek et al. Professional practice and innovation transformation of the emergency department processes of care with EHR, CPOE, and ER event tracking systems from the Health Information Management Journal of 2009. Thank you so much for taking the time to listen to my side of the ER puzzle of how do we improve our efficiency and how do we eliminate the wasted resource of time. Thank you again. Have a great day.